To give our patient audience some context before we get into the specifics of MPN treatment approaches, how would you define treatment goals?
Thank you. And I always like to highlight and emphasize that unlike many of the cancer syndromes that patients deal with, myeloproliferative neoplasms are unique. These are chronic cancers. There's no finish line. And this is a disease you live with. It affects everyday life, every activity of your future life. You plan your life events accordingly, pregnancies and marriages and trips and all of that. So this is a chronic cancer. And as we plan therapy, we always factor that in. We would like the cancer to have the least or almost no impact on your daily life, whether it's symptoms, whether it's disability and dysfunction and inability to perform your daily functions, whether it's actual physical symptoms that you're having from the cancer, or whether it's affecting complications that are hurting your health. So we would like to focus on all of these, the medical aspect as well as the impact of the disease to everyday symptoms. This is a unique feature of these cancers, and it doesn't really exist much in other diseases. So as we approach our patients, we would like to get a good assessment of the disease burden to their lives. This can be symptoms. So we actually have very good objective tools to measure symptoms, such as the MPN SAF. It's an objective tool to calculate the symptoms. So we would like to get an objective baseline of symptoms, because we do want to address the symptoms, regardless of the MPN subtype. We do want to master actually the symptoms, because that is what patients feel every day, and we want to affect that early in the treatment. We also would like to get a good assessment of the disease complications. Have the patient suffered a clot or a hemorrhage or a symptoms because of an enlarged spleen, or were they unable to perform certain activities? Are they unable to eat? Are they losing weight? So we would like to see how is the cancer also causing them immediate morbidity. And we also would like to tackle the future. So cancers tend to get worse with time. They tend to transform into a higher risk cancer. So as we approach any of the MPN patients, we also talk about the future risk of the cancer turning into a more aggressive form of cancer. So we would like, if we can, for every patient to focus on these three pillars of their care: their immediate quality of life and symptoms, their immediate complications, and their future disease progression. And we would like to factor in that our treatments does not add more side effects to their lives. So that's the fourth pillar of how we take care of patients. So these are the basic concepts that will apply today for all patients with all three diseases. Some patients will have more emphasis on one or the other, but this is something in our mind as doctors who treat MPN patients